It's great to be doing an interview in this room, which is one of our mock-up rooms for the new UCSF Benioff Children's Hospital, our Women's Hospital, and our Cancer Hospital, all of which is now going to be built just a couple hundred yards from where we're sitting here today.
It is hard to overstate how important Mission Bay is for San Francisco and for the Bay Area. When I talk to people both in the neighborhood and the local community, but more importantly all over Northern California, this has become a hub of innovation. And so what the UCSF Medical Center brings to that is patient care. It brings life sciences, biosciences, venture, biotech, all of that vibrancy that's already here, and adds to that, connecting that to the clinical care.
And being in this part of San Francisco, we're going to be adding thousands of jobs and involving a community that has been quite a bit distant from UCSF in the past.
Well, the ability to have a helipad, but more importantly, to have the community support for a helipad in this area makes what we can accomplish at the Benioff Children's Hospital even more special. One of the things I think is most important for an academic medical center, and specifically for UCSF, is to see that kind of progress and innovation in everything we do. So this project brings innovation to how we think about the environment for our patients and the clinical care, but it also allows us to look at Mount Zion, to look at Parnassus, and think, okay, now what's the next step for making sure that the space that we have at Mount Zion and Parnassus is consistent with the kind of environment we want for everybody, not just for clinical care, but for research, for education, for our students and staff and faculty. It's a huge opportunity for us.
And I think about being in a room like this one and just imagining how much more space we're going to have for the patients, the families, the caregivers. This is going to be a much healthier environment for everybody to work in and receive care in.
Well, this is a big moment in time. This is a huge milestone. Since I started as Chancellor a year ago, we've been focused on September 2010 Regents meeting and getting the fundraising, moving things along, everything we needed to get that approval. So this means for me that the hospital project at Mission Bay is really going to happen.
You know, to me, I think about the thousands of jobs that will be created. I think about how this helps the city of San Francisco, certainly this part of San Francisco, but mostly I think about the patients who are going to be helped here and helped at Parnassus and helped at Mount Zion because we have more space to provide care in the way that we really want to. And I think that will be the greatest legacy of the Regents' decision is what this does for patients and their families.